Welcome to the Genius Factory. Enjoy the video.
Do not drink a vitamin D injection. Injectable formulations are sterile solutions designed for intramuscular or subcutaneous use only and are not safe to swallow. Drinking an injection can cause local gastrointestinal irritation, altered absorption, or unintended systemic effects from preservatives and solvents. If someone ingests an injectable vial or ampule, seek immediate medical advice and have the product label available so clinicians can assess ingredients, dose, and risk. Always store injections separately from oral supplements to avoid confusion. If an injectable vitamin D solution is swallowed, treat it as a potential poisoning and contact a healthcare professional or local poison control center right away. Provide the label, exact volume, and concentration so clinicians can determine active ingredient amounts and possible toxicants like preservatives or solvents. Do not self-administer home interventions such as induced vomiting. Follow professional advice. While awaiting guidance, monitor for nausea, vomiting, abdominal pain, dizziness, or changes in consciousness, and be prepared to describe these signs to emergency staff. Safer alternatives include oral vitamin D supplements and dietary sources. Typical oral dosing ranges from 400 to 4,000 IU per day, depending on age, deficiency, and clinician guidance. Injections should be given only by trained healthcare professionals using proper technique, correct dose, and single-use sterile equipment. Do not self-administer parenteral products unless specifically trained. Store injectable products as directed on the label, avoid freezing, and return opened vials per guidance. Follow up with 25-OD blood testing to confirm levels, often aiming for about 30 to 50 ng/ml, and adjust therapy with your provider.
Thanks for watching. If you found this helpful, don't forget to like and subscribe.